been participating? Or let's do it this way. How many of you guys have never participated in the wellness program here before? Anybody new to this? Oh, good. So this will be easy because there's not a lot of changes. How are things going for everybody? Is everybody comfortable using the platform, knowing how to upload documents? Okay, so, well, I think what we'll do then is we'll kind of go through things pretty quickly then, since everybody's pretty aware of things, just for the sake of your own time. And then for anybody who has any detailed questions or wants to go over something a little bit more detailed, we can have you, we'll just go over things a little bit more if you want to when we're done. Let me see if I can pull this up here. Okay, what am I doing here for the mouse? Here we go. So do you guys all remember what metabolic syndrome is and why we focus on metabolic syndrome? It should be, everybody's got in their packet, their wellness packet, right? That explains changes for this year. And just as a, while we're waiting for this to come up. Okay, so what we do is when we look at, and why we look at metabolic syndrome is it's a way to take a group of people and determine what your risk factors are. And so we know that 34% of the general population has metabolic syndrome, okay? People over the age of 60, 50% of those folks do. So what's the big deal about that? If you have metabolic syndrome, you are at least a 4 times greater risk of having diabetes or developing heart disease. So when we look at that then, what we're trying to do is we're trying to put together a strategy to help you to prevent those types of things. And we know that there are lots of things that you can't prevent, and sometimes, you know, God made us who we are, and our parents have certain genes, and that's just how it is. But there are a lot of things we can control. So we're going to kind of talk about that and how we can kind of decrease those risk factors. And that's kind of the motivation or the why we focus on that. Okay. Again, so most of you guys are pretty aware of this. Just as a quick review, it's not a disease, it's just a risk profile. Again, it tells us how are you at risk. So when we talk about elevated glucose, we talk about a glucose of over 100. If you go to your doctor and your glucose is over 100, he's going to say, no big deal. But when you look at them in regards to these other risk factors in that combination, and with 3 of these that are over those ranges, then it becomes that bigger deal. That's when you have that greater risk of developing diabetes and heart disease. A blood pressure greater than 135 over 80. If you have an increased waist circumference, you know, guys, if your belly measures, you know, greater than 40 scales, if we carry our weight over around our waist and it's greater than 35 inches, you know, it puts a little extra work on our organs. Again, it just gives us an increased risk. Your triglycerides are over 150. Again, that's one of those risk profiles that we're looking at. If your HDL, which is your good cholesterol, you know, we want that to be over 40 for guys, over 50 for gals. So again, if you have any of those 3 things that we just talked about and they're out of those ranges, that designates that you have metabolic syndrome and it puts you at that greater risk. Again, so we all know too, as a nation, we're just, you know, we've gotten a little chubbier through the years. You know, if we look back in, like in 1970 until now, people, they weigh 19% more. We're just a heavier nation. You know, we're more sedentary. Technology is a great thing, but it has made us a more sedentary nation. In the past years, I think, you know, because of wellness programs and there's been more of a focus on prevention, we're starting to see more of a focus on becoming healthier. But if you think about it socially, I know I am so guilty of this. When I am with my friends, what do most of us do? We eat. We go to dinner, or we have cocktails, or, you know what I mean? And, you know, so how often do you do things that are physically active with your groups of friends? I have friends now that we get together and they play pickleball a lot. I've not done that yet, but they keep telling me, you know, and I think that's kind of awesome that instead of, you know, well, actually they've been calling it, what do they call it? Pickle beer barrel ball, because they end up, they'll go and they play pickle barrel or pickleball for a couple hours and then go to beer barrel. I'm not real good if that's good or not, but it's, you know, but at least you're seeing that change. Where it used to be all you did was you went to beer barrel, you didn't do the pickleball at all. So you're starting to see that shift. And you're starting to see more of that focus. I know I get peer pressure from my girlfriends. They made me join Anytime Fitness. So, you know, again, you're starting to see a little bit of a shift in that. again, we kind of went through this already, so, and you guys know, because of metabolic syndrome, there are complications of that. And besides just the diabetes, you also can have respiratory problems, you know, people who are heavier, you know, you have sleep apnea. There's just all kinds of other things that can lead to that too. So we wanted to start looking at how can we prevent some of these things. And as we said, there's some things you can change, there's some things you're not going to be able to change. And we get that. And you're not going to be penalized for things that you can't change. So often in wellness programs, people say, well, you know what, I've been doing everything I can for my cholesterol. You know, and I just can't change that, and that's okay. You know, there are ways that you're still gonna be able to earn all those points. And hopefully you guys, and I think everybody said they've been participating, that you know that Katie's gonna work with you to try to make sure that you all can meet your goals. Okay. And again, when we talk about ways to treat, you know, I think sometimes, where's this, I think it's this side. You know, I think this says a lot about ourselves. When we look about how do we, I mean, so, and again, I think sometimes our biggest problem is sometimes we're not real honest with ourselves. And we look at things that we can change and things that we can't change, and we're real quick to say, hey, my mom had high blood pressure, my dad had high blood pressure, and I'm just gonna have high blood pressure. Well, and sometimes treating it is not always getting on medication either. So if your blood pressure is consistently, you know, greater than that 135/80, and you know, you've been watching it and you're just not there, and you don't need medication, but there are things that you can do. Even from, you know, losing 5 pounds can drop your blood pressure up to 10 points. You know, decreasing your sodium intake, or you big pop drinker, some of those little bitty things you can do, but you have to be real honest with yourself and say, oh, it's not just hereditary, and I know there are things you can work on, and we all have those things that we can work on. And you know, and one of the things I found, even just with myself with a wellness program, is I always participated in the hospital's wellness program when I worked there. In the past 2 years, I've had 2 foot surgeries. And the first time I was on a scooter for 12 weeks, and then last year I was on crutches for 8 weeks. And this year, I am 7 pounds heavier. And I'm still working to get that off. Now, if I had a wellness program and it meant $600 to me, I'd have been probably a little bit more stringent about watching what I ate. Because I went from walking, you know, 3 days a week to not walking at all, and I didn't change my eating habits at all, you know. And so, yeah, I think you do. You just kind of be honest with yourself, and sometimes people are like, oh, why do we have to do this? But I think you'll find by participating, like I said, we keep talking about how, you know, people on the average, they'll gain a couple pounds every year, and we've noticed just in what we do that helps us to at least maintain our weight. And even if we maintain our weight and don't gain anything, we're still ahead of the game. So there's a lot of value in participating. Okay, so everybody has seen this before, right? Everybody's got their checklist, and everybody knows their calendar events. You're all familiar with this, so you know that when you get these calendars, what they mean. So this is, I think, you guys did a holiday maintain already, right? Okay, so it looks like you've got a 60-day challenge that you're doing right now, correct? So good, hopefully you're all participating, and you all know how to upload your documents or how to get credit for that. Any questions on any of those types of things? Okay, so great. So hopefully you guys have got this calendar in your offices and close by, and you know how to take care of all those issues. Okay, and again, this was just a tool Katie had developed just so you could check off and have it in a nutshell, think, okay, where am I at and what can I get done? And for those of you people who are, you know, like colonoscopies that are part of your program, if you're over 50 this year and you've never had a colonoscopy, that's something you're going to want to talk to your doctor about. It's pretty easy, actually, I think, to get credit for everything. We're not asking you to, like with your primary care doctor, you're not asked to go get you don't have to get a physical, but we want you to see your provider. It's really important that you see your medical provider at least annually. For a couple reasons. One, if you've got a good relationship with your doctor and you've got a good baseline, and then something happens, he knows your history, he knows you, he's going to be that advocate for you. It could be he or she, I'm just using he as a general term because my doctor's a guy. But anyway, the other thing is too, is so I see Dr. Smith. I haven't seen Dr. Smith in 7 years. I've got this really bad cold. So I call him and I'm like, hey, I want to schedule an appointment. And they said, well, what's your name? I say, I'm Lisa Krieg, and we haven't seen you in 7 years, you're no longer considered a patient. Yeah. So what happens then? I need to be treated. I'm going to either end up going to the ER or I'm going to end up going to urgent care. It's going to cost me more money. It's gonna cost me more time, and again, I don't have that person who knows me to help treat me. So again, that's why it's really important. We want you to see that physician and have that personal contact with that person on an annual basis. And again, it's really important. So that's why those kinds of decisions are made. And so you guys all know how to do your preventative health, that type of thing. Everybody's already registered on WellScript. Anybody have any difficulty? No? Okay. Again, I know I'm going through these really quickly, but I figured if you're all using it, there's not a lot of reason to go into a lot of detail with them. Again, I don't think there's any new tiles or anything that has been up. And you guys, does everybody have Katie's contact information too, and you know how to get a hold of her if you have any problems or anything that's uploaded, or you've got a question, or you know, you're thinking, gosh, I submitted my colonoscopy, I'm not sure when I need it again. She's got all those records. You can shoot her an email. She'll get back with you and let you know, hey, you know, Lisa, you had your colonoscopy and it was, you know, 2009 when you had it. Your doctor said you weren't due till 2019. So any types of those types of questions, she may not get back with you exactly that day because she's in and out a lot, but she'll get back with you. So, okay. You know, you guys get reminders, those types of things. Everybody completed an HRA. Do they require you do one every year? Okay. So, again, these are just things that you can kind of do on your own. Do you guys have access to this at home too, or just at work? Depends. Okay. And your screenings, I think that was a change for this year. Now, and correct me if I'm wrong, right? So in the past, if I remember right, you guys did your screenings usually in the fall, and then your deadline was in October. And from what Katie explained to me is that, and I think this is a great idea, you've moved them up into April and May of this year to give you more time to work on things, to make those changes. So if you are that person with that high blood pressure, you know, you can, you know, try to lose the weight, start reducing your salt intake, seeing your doctor, those types of things. It's going to give you more time. Okay. So again, you guys all know how to see online whether or not you've met the criteria and what you've got to do, correct? And again, you know, there's a way that online too, you can look to see how many points that you've earned. And everybody comfortable uploading files and getting that information to Katie. For some reason, if you're really having a difficult time with it and you really can't get it uploaded, you can fax them to her too. You know, she'll take care of it for you on that back end of the system too. But it is pretty easy. If you have it on your computer, choose the file, upload it up, and press submit. It's very simple. Okay. Now, are you guys doing anything with custom trackers, with pedometers, or linking those two? Okay. Okay. And you know, okay. So, and there are ways on there too. You can send Katie messages directly on through the WellScript site. So, I know we went through that really quickly. But what other changes are new for this year? Shelley, Julie, yeah. Let me look on here.
Not a whole lot.
Not a whole lot.
Kind of kept it the same. People, I think, you know, we had started a lot of this last year, and just for the comfort level, and just keep it the same, and not too many changes.
Yeah. And you know, the first year you guys did this too, and I don't know how last year's results were, but you've caught some very substantial illnesses, I would say. You know, you've really caught some really good things by doing this program, so that's good. I'm looking at your packet, and it looks like it says things that are new this year is that you can go and get your lab work done at your doctor, or if you've had lab work done, you can submit that for your screening if it's done within the last 3 months. But you'll still need to get your measurements done at the screening. So if you've been to the doctor and you've had a lipid profile and a glucose done, fasting glucose, you can use that instead of having your lab work done here. Now again, that's going to be, you know, you just can't go there and they'll pay for it for your screening, but if you've had it done already, you're thinking, but you still need to come in and get measured. And it looks like that's what's new for this year. What else? It looks like too, in your insurance this year will pay 100% for an annual physical. Okay. And again, the thing.
That's not new.
That's not new. Oh, okay. Okay. I would caution you though, when you do go in for a physical with your doctor and you're anticipating it to be paid for at 100%, sometimes if you go in, the doctor finds something incidental. I go in, I think, hey, I'm just here for my physical, go and get it done, and you know, your blood pressure is high. And he puts on here and he diagnosed me with hypertension. It no longer becomes a physical. They have to make sure that he codes it as an annual physical, so it's paid at 100%. We get that a lot of times. So, you know, and again, it is what it is. I mean, if you have a problem and you have that diagnosis, you know, but I always encourage people to have that conversation with your provider, how they put that diagnosis code on, because it will make a difference in how it's covered under your insurance, so just make sure you get that.
You're saying wellness visit, I need to schedule a wellness visit, sometimes triggers the right code to your doctor's office.
Yes, exactly. Just tell them what you're there for, and then when you look at it too, just make sure, you know, have those conversations. You guys don't have high deductible plans or anything, do you? Do you?
Mm-hmm.
You know, and so since we've kind of gone through this and you don't have any questions, let me tell you a little bit about this. So this is our first year, my husband and I went to a high deductible plan. Learned a lot. I've learned that I call now, when I get a bill, I will call, and I'll call like Fate Rita, they just had some things done, and I said, hey, if I can pay you this bill up front, what will you give me? And the bill was like $1,200. And they said, we'll take 20% off. They took 20% off my bill. I said, okay. So I took it and I paid for it with my little HSA money. And so then I called the doctor's office. I said, if I pay for this in cash, and I can pay you on the phone right now, they gave me a 10% discount. Always ask for the discount. All they do is tell you no. And my dentist, I did the same to them, they told me no. Like, they kind of looked at me like, are you crazy? But, I'm thinking, okay, so this was a couple phone calls, I saved myself like $400 just by asking. Don't be afraid to ask for that discount. The other thing with pharmaceuticals, check around, the prices it's a huge difference from pharmacy to pharmacy, what you pay. And I keep a little spreadsheet. I'm not the most organized person, but my husband, he's the super anal guy. So I document all this stuff just for tax reasons now, but, and I always check on there, so I kind of know who will give me a discount and who won't. And again, looking like I am on thyroid medicine, and I called 4 different pharmacies, and then I discovered Walmart, I can get a 90-day supply for $10. And I've never used Walmart pharmacy before. A lot of those, some of them have free antibiotics. So get to know some of those programs. Start looking. You can even search them online, but don't be afraid to ask for discounts, or even to tell your doctor and say, hey, I have a high deductible plan. What is it that I can do that's going to help save you some money? I'm taking high blood pressure medicine. Is there a cheaper alternative that would work just as well? Don't always ask those questions.
There's an app you can get to. I think it's called GoodRx.
Mm-hmm.
You can click on it right there at the doctor's office, and because now a lot of the prescriptions are sent electronically, you don't get a paper prescription that you can choose later. So I've checked right there at the doctor's office, and you just put the medication in, and it'll tell you the local pharmacies which has it cheapest. And I said, oh, send this to this place instead because it's $20 cheaper.
Yeah, you definitely can do it. Yeah.
When you did that discount, is it after you found out what the reasonable rate was going to be, after it was submitted to?
I did. I waited till I made the phone call until my insurance, and I knew that a lot of it was gonna go towards my deductible. So I waited until I had my EOB in hand, my explanation of benefits, and then I made that phone call. And I even said, hey, look, this is, my bill was whatever, $1,200. In my EOB, they were all on the same page with it, so it was all the same. I said, I just wanna know if I'm able to pay this off today. And, I had that in my, had my money in my HSA, but I wasn't gonna tell them but I said, yeah.
Mistake.
Yeah, so just always ask. I mean, like I said, so you may get some no's, but you may get some yeses. So, and any of that money that you save, you can just continue to use it for other things. So yeah, that whole, when you have, gosh, you have a couple $1,000 deductible, it kind of hurts sometimes, especially like our HSA money comes from my husband, it comes out of a monthly. So until it's in there, I can't spend it. So this first year, it's just been this big learning curve. So you need to be good consumers of your own health care. Don't be afraid to ask your doctor too if you have lab work done. If you have high thyroid, for instance, and you just had some thyroid testing done, and he says, you know what, I'm gonna have you come back in a month and we're gonna discuss your results. Say, hey, can you just call me if I need an adjustment? And ask them. And sometimes they'll be like, oh yeah, I'll just give you a call. Or, I'm a part of, like I said, the Mercy Health System, and we have, I have my chart. And a lot of times you can just shoot them an email and say, hey, can you just email me and say if I need an adjustment, if I need to up my little, there's nothing worse than going in to the doctor's office and I'm like, hey, your levels are great, see ya, next year. And you're like, dang, I have paid how much money just to hear that, And again, just make better use of your time. And there are sometimes they'll say, no, we need you to come in to discuss or this or whatever. But always ask. Never be afraid to ask. So, but yeah.
That Good RX card that Shelley was talking about, I went to a dermatologist in Columbus recently and he gave me one of those. And this prescription he gave me for is like cream for around my eyes and it's $450. He said with this Good RX card, you're gonna get it for $88, like at Walmart, like that big of a difference. So I went to Walmart, gave him that card, and it came up $300 and some dollars. And I said, that's not what that doctor showed me on my phone. Well, there was a phone number on the bottom of that card, and I called that number, and this was just yesterday, and I ended up getting that cream for $79, and it's $400, and that's the generic. The brand name is $600.
Yeah.
So those cards, if you can get those from your doctor, that's like a gold. If you have a really expensive prescription.
So it's not an app, it's.
No,
You can go on the app. He showed me the app on his phone, the doctor did.
Yeah.
But then they gave me a card in their office.
Yeah.
Yeah.
Always, like I said, always check into those things and, yeah, and even if they tell you, like you said, good for you for saying, hey, that's not what they told me.
I did.
You know.
That's too
Yeah.
much money.
You know, and another thing too is sometimes if the Good RX doesn't work, I've had this happen too, where, if it's a brand name, go to the pharmaceutical company's website, and sometimes they'll have things for the first so many months, you can get it at a discount, or for the first year, they'll give it to you for so much a month. You know, look at those things. You know, and to me, I find that it's worth the time to spend doing a little bit of homework to save yourself that money.
And some drugs, they rotate them at different pharmacies. Say Kroger will have a blood pressure medication at a lower discount for a month, and then it goes back up to the regular price. And
Yeah.
maybe the next time Meijer will pick it up and they'll lower it, or maybe CVS. So that's why checking that, even if it's routine medication, the price drops at different pharmacies just because they're trying to promote it and they want to bring you in.
Yeah.
But
Because they know if you're gonna go in there and pick up your thyroid medication, chances are you're gonna grab a thing of milk and some bread when you're walking out the door too. So it's real competitive, they wanna get you in that door. So you're right, Shelley, you know, and it does take a little bit of time, but once you start getting used to those things, you know, you can definitely save yourself some healthcare money. So. All right, well, you guys are all plugging along really well, so again, that was pretty quick and painless and some good discussion. So again, I guess too, the other message is don't ever be afraid to ask us any questions too. We'll talk about that. So if you've got a problem or something that isn't quite right, or you're concerned about how am I gonna, you know, meet that goal or whatever, shoot Katie an email and she'll be able to talk you through it. Okay? And then make sure everybody signed in. If you came in later, make sure everybody got signed in.